Hello everyone, Dr. Sherwin here from Artistic Dental Studio with another episode of Dental Tips of the Week. I'm going to cover the topic of wisdom teeth for you today, and I'm very excited because it's a very hard topic. There are many questions around this topic, and I'm very happy to be able to address some of them. Now, let's jump in. First of all, let's begin with why this topic is so important. The reason why it's so important is because wisdom teeth are problematic. They cause problems. And the reason why they cause problems is because either there is inadequate space for them to grow, or there is some kind of misalignment involved, or they assume bizarre shapes and types. So it caused some problems in mouth, and then patients come back to us and ask for removal. Now the question is why this thing is happening. Basically, first of all, why is this happening? We need to get back several thousand years ago, when the primary diet of human beings was something like quite fibrous and very hard to chew, like more grains and vegetables and all the stuff. And this is why the jaws and the shape of the face and everything was much bigger than what it is right now. Because now we've shifted to a more kind of processed soft food. And these changes over time in the process of evolution actually has caused human beings to have smaller faces, smaller, especially jaws, lower jaws, and less number of teeth. And wisdom teeth are the teeth in this process of evolution that have undergone a major change, because nowadays we can see many people without wisdom teeth. It is getting eliminated, and in many people we've seen there's just wisdom teeth in one jaw, in the other jaw they're totally absent, or in some people we see they can't grow, or they just come out at like different angles and locations with different shapes. So all these things have contributed to the present problem of wisdom teeth. Now, what sort of problems does this wisdom tooth or wisdom teeth create? First of all, the main problem is the gum swelling, inflammation, and infection. This is a thing that is very, very common around wisdom teeth. The second thing is dental decay, because these teeth are located far back, they're really hard to reach, and as a consequence, they get decayed. The third thing is some kind of pain. It could vary between a vague kind of pain to a very, very sharp and intense. And also it could cause food retention, and it's very hard to keep them clean, and it could cause, as a consequence, it could cause bad breath as well. Now, the question is when we need to remove wisdom teeth. This is a thing, or this is the question that your dentist could answer very well based on some findings. What are these findings? First of all, if the wisdom teeth are not functional ones, let's just assume patient has two lower wisdom teeth and there are no top ones. So the lower ones actually are doing nothing for you in the chewing cycle. This is a thing that could be a trigger for wisdom tooth removal, because it's doing nothing for you. If this thing is combined with other factors that I will introduce to you right now, we may change our opinion toward more removal than to save them. The second thing is misalignment. When the wisdom tooth is not as straight as the neighboring ones, the front tooth, or the opposing ones, it will not be a completely functional tooth. Third thing, there could be some kind of untreatable decay on surfaces of the wisdom tooth, and it's very hard to actually reach that area to do some kind of treatment or do a filling or something like that. The fourth one is if there are many cases in which there is a kind of lesion around the roots of the wisdom teeth, and we better not take a risk. We prefer to take them out, clean up the lesion, just to make sure it will not get cystic or possibly, in some very rare cases, malignant. So we need to be very careful about this as well. The fifth one is the access. There's no access in some of the wisdom teeth to fix. Let's just say wisdom tooth is like decayed and we want to fix it. In some cases, we cannot, even as dentists, we cannot reach that area to clean the decay up and put a filling on the top of it. So we need to take the tooth out because it will ultimately get infected and cause even more problems. The access thing, in many cases, it's very, very hard for the patient to access that area to keep it clean. Simply, they can't do brushing and flossing around it. So that's a thing that could trigger us to think, well, that's a good candidate for extraction because it could cause some problems down the track. The next one is food retention, which is very common around wisdom teeth, in the space between the wisdom tooth and the front tooth. And also some wisdom teeth are covered with a layer of like a flap of gum, and all food debris and everything, bacteria, saliva, everything goes underneath that flap of gum. It's really, really hard to clean, if not impossible. So in these cases, because these areas of bacterial accumulation causes like inflammation and infection, we better remove the wisdom tooth. And if there, by any chance, there is any kind of inflammation or infection of the gum around them, then that's a game changer for us. We may think, well, we have to think about taking the tooth out. Now, I just wanted to answer a myth about wisdom teeth. As a dentist, I've been asked plenty of times, and patients are under this impression that wisdom teeth apply pressure to the tooth on the front and cause them to get crowded, and if the wisdom tooth is taken out, the teeth will get back to normal and get back to their original position. First of all, I need to say, this thing has no scientific backup. Alright, so it's not necessarily true. And even if this is true, if the wisdom tooth is taken out, teeth will not get back to their original positions and the crowding will not correct itself. Okay? So this is a thing that people normally think that, okay, wisdom teeth is the problem, and if we take them out, then the teeth will be aligned after a while and everything will be sorted out, and in fact it's not true. And let's now dive in different types or different classifications for wisdom teeth. Okay, the wisdom teeth are classified mainly based on 3 criteria. The first one is their classification based on the mode of impaction, how impacted the wisdom teeth are. Some of them just grow like a natural tooth. In many cases, they are impacted. They are covered by gum. So we need to do a kind of surgery to take the tooth out. Now, let me show you this picture. I hope you can see very well. And as you can see here, the wisdom tooth is underneath the bone, the hashed area, and covered by gum. So in order to take the tooth out, we need to flap the gum and then remove the bone in order to take the tooth out. So in terms of the level of difficulty, these extractions will be a bit harder compared to the other side where the wisdom tooth is just covered by a layer of gum. So we could easily make a flap and take the tooth out. So this is one way of classifying wisdom teeth. The second way of classification of wisdom teeth is how the wisdom tooth is related to the nerve underneath that. Let me just enlarge my... Alright, so let me explain it like this. For lower wisdom teeth, there is a nerve traveling from the angle of the jaw and coming forward underneath the wisdom teeth and coming and giving the innervation or the sensation to all the areas of the lower jaw and up to the midline, to the chin. And this nerve is really, really sensitive. We need to take good care of it. Depending on the relationship of the wisdom tooth to this nerve, this relationship greatly affects our decision on how we need to take them out if we want to do it. Because in some cases, because of this relationship, we just leave the wisdom teeth and we never touch them. So let me show you this diagram here. So this one here, as you can see, the wisdom tooth is in the vicinity of the nerve. It's not touching the nerve, but it's in the vicinity of the nerve. So in these cases, the dentist should be very, very careful not to traumatize the nerve, because otherwise you may suffer from like loss of sensation or tingle sensation on half of your jaw for a long time, possibly several months. So that's very important to be very careful. It's not a contraindication to remove the wisdom teeth, but the dentist or the surgeon has to be very careful about it. This one is the case where the nerve is well away from the tooth, so no big deal at all. It's quite easy to remove in terms of the nerve relationship to the nerve. And the last one is when the nerve is actually connected to the tooth. In these cases, even if wisdom tooth is causing problems, we may opt to not touch it, because if we take the tooth out, we may damage the nerve and cause some permanent kind of damage, and it will not be reversible. So in these cases, we prefer not to take the tooth out, and there are some methods in which we can bury it down the tissue and cover it with tissue completely in order not to take the tooth out. And the third classification of wisdom teeth is based on their location in relation to the front tooth. That's very important. Wisdom teeth could be nearly parallel to the front tooth. The straight ones are normally easier to remove. Could be located at an angle toward the tooth or away from the tooth, making it a bit more difficult to take out. It could be like horizontal, very hard to take out in many cases. It could be inversely located, even harder. And in some cases, it is located toward the cheek or toward the tongue, like horizontally, in and out. And all these combinations could exist and largely determine the hardship during the surgical procedure. Now that I told you about the classification, let me just talk a little bit about how we take the wisdom teeth out. If the wisdom teeth are easy to remove, it could be easily done in the dental chair with local anesthetic. There's nothing in particular about, unless the patient is quite phobic about dentistry, in which we need to do some kind of like sedation or some other measure. But if by any chance wisdom tooth removal is hard, for example, it's like an inversely located wisdom tooth, or it's very close to the nerve, in these cases we may like to have patients sedated, which could be done with like parenteral ways, like injection kind of thing, or oral ways, or even using happy gas to just sedate the patient. The third option is putting the patient to like sleep and general anesthetic. In these cases, it is quite possible to remove all 4 wisdom teeth in one go and finish the case. So, depending on the systemic condition of the case, of the patient, and how concerned they are and how hard the removal is, we can easily determine what type of approach suits the patient best. All right, I hope this video was quite concise, I know, and I hope it was helpful enough. And please just stick around for next week's video. I will talk about full mouth rehabilitation. Yeah, that's a very, very interesting topic. And please leave your comments down below, and also post your questions or any concerns you may have about this video, and please share it with your friends. Thank you very much. It is always nice to see you guys, and my pleasure to help you with your dental questions. Thank you and have a good day. Bye.